I mean, Tamsin did that wonderful interview of interviewing the doctors of how much training did you actually have based on menopause?
Less than a month, over 12 years of training.
Yeah. And every doctor said the same, or less than a month.
Less
Some
than
said
that.
2 weeks, or 12 hours or something.
So less than 20% of board-certified OBGYNs currently in this country are trained in menopause and sexual health care. 93% of medical students report graduating with being unprepared to take care of the menopausal population. And thanks to, you already mentioned this, increasing lifespan, we're going to spend about 40% of our life in menopause. So these doctors are not prepared to take care of us, for 40% of our lives. And so at HerMD, we've developed something called HerMD University, which is only open to our own physicians right now, but I'm training all of our doctors or mid-levels. It's a very nice program where everyone's trained. So 100% of the providers are trained, because we had to fix that paradigm as well. I'm like, I can't live with that statistic. That's horrible. Mm-hmm. Eventually, we will be developing our own continuing medical education, so we can help other providers get trained, because there's also very few institutions that do train physicians. And when you're busy and you're seeing patients and you're trying to pay the bills, to take a week off to go get these certifications, it's hard.
Well, I'm happy you're raising this, because I think what I hear a lot in our community, and I wonder for this group here today, is I think you are seeing the trickle-down effect of the lack of education in medical school, because I think part of what's happening for our generation is a lot of doctors are still very conservative about hormone replacement therapy. You go to your doctor, a lot of us really rely on our doctors or our OBGYNs, and I have found a lot of those conversations are, end with very conservative. They're still a little bit unsure. And so it really takes forward-thinking doctors like yourself, right, today to really push this conversation forward. And hopefully you'll see that, have a positive impact for our kids and future generations.
I was just interviewing some candidates this past week, a lovely, very intelligent, bright doctor. When I asked her take on hormone replacement therapy or hormone therapy, she's like, shortest duration, shortest amount of time. And I go, who told you that? She's like, ACOG. I was like, that was like 2 decades ago, but we just haven't, but it's not her. She's not being taught, right? And so I was like, I got off the phone. I'm like, yep, nope, not going to be a good fit for HerMD, because I can't have someone so conservative. You have to move with the times. You have to get the education.